and thanks for joining us for today's episode of CHS Presents Health Connect. I'm Dr. Patrick O'Shaughnessy, Catholic Health Services Senior Vice President of Medical Affairs and Chief Medical Officer. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a strong commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to take this time to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. On today's show, a serious topic: prescription drug abuse and the heroin epidemic on Long Island. According to the Centers for Disease Control and Prevention, 45 people die each day from an overdose of prescription painkillers or opioids in the U.S. The non-medical use of prescriptions may also lead to the use of heroin, an illegal, highly addictive opioid drug whose addiction and overdose deaths continue to climb each year, both in the United States and here in New York. So for the folks at home, this is a very important topic, near and dear to me. For all the years I've practiced as an emergency physician, I've seen far too many people and their families succumb to this poison. It is truly an epidemic that we have here on Long Island, but we're not alone. Colleagues in different communities in different states across the country are dealing with the same problem. We in healthcare, unfortunately, still have much to learn, but we're learning quick and we're changing a lot of how we practice and prescribe these medications. We're also working on expanding some great services in our communities to help treat this problem. This epidemic is on the rise right here in the communities that we live and work. And CHS believes that these addictions are treatable and that individuals who want to change can achieve success with the proper recovery program. On today's show, we'll explore the available programs for those struggling with a substance use disorder with our guests that include Mr. James O'Connor, the Executive Vice President and Chief Administrative Officer at St. Charles Hospital, Dr. Jeffrey Reynolds, the President and CEO of the Family and Children's Association, and Mr. James Morse, the Director of Crisis and Residential Services at Mary Haven Center of Hope. We hope you stay tuned to learn more about where perhaps you or a loved one can find their way to the road to recovery on today's episode of CHS Presents Health Connect. Hello, and welcome back to CHS Presents Health Connect. In addition to education and counseling, detoxification is considered the first step in recovery from drugs and even alcohol. But withdrawal can be severe. St. Charles Hospital in Port Jefferson offers drug and alcohol detoxification in a medically supervised detoxification center and rehabilitation to learn how to maintain sobriety. Joining me now to discuss these programs at St. Charles is Mr. James O'Connor, the Executive Vice President and Chief Administrative Officer for the hospital. Welcome, Jim, and thank you for being here.
And thank you for having me.
I know St. Charles very well. I often say it's the first place that I gained introduction into CHS, and I'm working for you in your emergency room. I know the valuable services that it provides to the community, focusing in on high quality, high customer service. Tell me a little bit about the program that you've built there and the services that are offered there and how it's impacting the community.
Okay, thank you. I will. It's funny, when I came to St. Charles in 2004, we had a very active chemical dependency rehab program that was one of the few inpatient rehab programs on Long Island dedicated to patients with, at that time, alcohol addiction more than anything else. What we saw over a number of years was a shift from less and less alcohol addicted and more drug addiction. And as a result of that, one of the things that we realized that we needed, because we were getting calls each and every day from parents and loved ones of addicted patients, was the need for a detox program and a medically supervised withdrawal program, as it's called, because it's not done without the concerns and medical needs of the patient being taken into effect. And with that, about 2 years ago, we opened up 10 chemical dependency medically supervised withdrawal beds, never anticipating the tremendous occupancy rates we would see. And on an average day at St. Charles, although we have 10 beds, we usually have between 17 and 19 patients.
So you're almost double occupancy from where your beds are.
And what has driven a lot of this is many hospitals on Long Island who at one time offered this service have moved away from it for financial reasons, for the fact that this is a very needy population, both medically, psychologically, and because of the fact that there are a lot of stigma attached to these patients. And you have to be special types of healthcare professionals to want to and to be able to care for people that admittedly have a disease, but frequently are given the title of, doing this or getting involved in drugs because of weakness and things like that. So we've really made a huge effort at St. Charles to care for those patients, both in a safe, secure, and compassionate environment. And I think we've done a great job. So we have 10 adult medically supervised withdrawal beds and 4 adolescent as well, because whether we like it or not, the adolescent drug problem is blossoming as equally as much as the adults.
I am so glad that you brought that forward, because I would see this on a pretty frequent basis in the emergency rooms. And for our viewers at home that think that this is just an adult problem, it is not. Unfortunately, it has migrated down into our teens and sometimes even younger, where children are getting influenced to take these medications by people on the streets, and they're getting strong addiction problems, many times with lethal consequences. So the fact that you actually have adolescent bed capability, again, in the same high quality and commitment to patient safety and customer service, embracing the individual as a whole, is a testament to the great care that you provide at St. Charles.
Thank you.
Talk a little bit about what you're seeing coming in, the types of people.
It was interesting. When we went to apply through OASAS, which is the regulatory agency for these types of services, there was a real concern in the community that what it was actually going to do was bring a lot of homeless into the Port Jeff community, that a lot of people that were then living out on the streets after treatment. And in fact, that isn't what we're seeing.
And that's not the case at all.
No,
you're seeing professionals.
Yes.
You're seeing people highly functional in society, many of whom have had a medical problem. We as providers write a prescription, they get hooked, and either they can't get that prescription medicine, they're moving on to illicit drugs such as heroin.
And given the fact that illicit drugs now are much cheaper than on the street than trying to get legal drugs, that has driven that population as well. The scary part about it, as I said to one of the assemblymen that I was speaking to, is many of these people are the same people that are driving on the Long Island Expressway next to you in the morning.
That's right.
And you never know.
And you never know.
They're functioning, but yet taking multiple bags of heroin a day to get through the day, but yet maintain jobs somehow until it all comes crashing down around them. And for many of the people, what we've come to find is they've had to hide these addictions and struggle with these addictions for many years because they didn't know where to get treatment or were so concerned about losing their job, loss of family, things like that, if it was discovered. So we're not seeing a homeless population. We're not seeing people that are uneducated or socioeconomically disadvantaged. In fact, we're seeing many of just the opposite.
That's right. That's right. Now, you recently you're going to be approved for some additional beds at St. Charles?
Yeah, because of the need for more medically supervised withdrawal beds, or detox beds as they're called in short, what we're going to do is we're going to convert some of our chemical dependency rehab, which is a 21 to 28-day program. We're going to take 10 of those beds and transition them with the help of the Department of Health and OASAS into medically supervised withdrawal beds. And this, again, underscores the tremendous need for that service because, as I said, theoretically, we are supposed to be limited by 10 beds, but with the tremendous need, we're not able to do that many days.
Yeah, and again, and you provide an incredible service for the community. I've been to your facility numerous times, and I see the quality of care that is delivered there, and I see the respect and dignity that is given to these patients as well, and that's very touching, especially for the families who are going through this along with the patient. So I thank you for joining us today, and I thank you for the incredible services that you provide, not just around this very touching episode, but around all the services that you provide at St. Charles. It's such a valuable member of the Port Jeff community, and we're thrilled to have you as part of CHS.
Thank you. Thank you
Jim.
very much.
We'll be right back with more guests to speak more about this important topic. Welcome back to CHS Presents Health Connect. Located in both Hicksville and Hempstead, the Family and Children's Association offers addiction treatment to adolescents and adults struggling with substance use disorder, as well as their family members and significant others. Here with me now is Dr. Jeffrey Reynolds, the President and Chief Executive Officer of the Family and Children's Association. Jeff, thank you very much for coming on the show today to discuss a very important topic.
Thanks for having me. It's always a pleasure.
It's great to have you. You and I have a lot of history together. I first had the pleasure of meeting you and working with you back about 4 years ago on the Suffolk County Heroin and Prescription Opiate Task Force. You've done such incredible work
Thank you.
on Long Island to help in this epidemic. Can you share a little bit, though, first about the Family and Children's Association? Tell our viewers what it is and what you work on.
Sure. We've been an organization that's been around for more than 130 years. Actually started out as an orphanage for homeless children way back in the day, and since then we've grown to have more than 30 programs. And as you mentioned, we run 2 chemical dependency treatment centers that these days are actually pretty busy, and those are located in Hicksville and Hempstead.
Yes.
You know, one of the key things you mentioned was the fact that not only are we treating patients, but we're treating families.
Yes.
And one of the great lessons out of, I think, this modern day crisis is the need to make sure that families are getting the help they need early on in the process. And in some cases, treating the family is just as important, if not more so, than treating the patient.
I agree. It's crucial. So, what are some of the things that you're seeing? I reflect back to my time in the emergency department, the patients that were coming in, and even when I used to work in New York City, there was a heroin issue on the Lower East Side at the time. We're seeing a lot of different types of patients, and I wanted to share one particular graph published in the New England Journal of Medicine that actually showed a strong correlation and rise and unfortunately overdose deaths associated both with heroin and prescription drug abuse. So the graph that I'm showing actually displays the number of deaths per 100,000 in the population. This is data from the CDC, and when I speak with colleagues even outside of our geography, they're having the same issue, different states across the country. What's going on?
It's a monumental crisis, and here on Long Island and elsewhere for that matter, the epidemic has continued to get worse and worse and worse. Each year we see more and more fatalities, and so if you look at this year on Long Island, the number is probably going to be about 400 fatalities for the year. And so
400 fatalities for the year on Long Island alone.
Yeah. So when you think about that, Pat, it means that it's more than one a day. It means that some middle-class family that doesn't meet any of the stereotypes woke up this morning, went about their business, and by this time tomorrow will be making funeral plans for a loved one.
Yeah.
And when we talk about those fatalities, often what gets lost in the mix is the roller coaster ride that family has been taking, usually for several years before there's a fatality. Sometimes it happens quickly, but very often it's like being on the most raucous roller coaster ride you could ever imagine, and then it comes to a complete stop.
Yes.
And then moms and dads and brothers and sisters are left with the incredible guilt that goes along with, could I have done something differently? And so, we're seeing these fatalities increase. There's been a major push here on Long Island to do some harm reduction education. That is teach people about Narcan, try to get them into treatment, that kind of thing. But as of right now, we're not winning the battle. Each year it's getting progressively worse.
So what do we need to do? What needs to change?
Yeah.
Let's talk about this from an advocacy perspective. I've had you out to even to some of the facilities. We've done some training in our emergency rooms. We talk about, what we can do in healthcare. Prescribing pattern changes is monitoring, tracking. How about on the insurance side? What else do you think we need to do?
If you recall, when we did the task force, we came up with a whole set of recommendations,
I remember it well.
pages and pages and pages. Most of it hasn't happened.
Yeah.
And one of the things that we said as a group was that at every step along the continuum, that is prevention, access to treatment, and support for people in recovery, there are giant, giant gaps. And the current crisis has put a giant spotlight on all of those gaps. The gaps have only grown bigger since you and I sat on that panel. And so when we look at prevention education, the Common Core curriculum has squeezed out anything that's viewed as optional in many school districts. And so schools are doing less education than they used to be doing even. When we look at access to treatment, this region has not gained a lot of beds. In fact, we've lost some beds.
Correct. This is precisely why we're trying to actually put more inpatient facilities
in. Which is so welcome and such a huge help. And then when we look at recovery support, one of the things we all talked about was how come we're the only major metropolitan area without a recovery center for young people to go? How come we don't have a recovery high school? I think all schools should be recovery high schools, but they're not. How come sober homes are unregulated in this region and across the state? And so a lot of the things that we suggested
never came to fruition.
Haven't happened. And so and then elected officials sit and say, how come the problem's getting worse? It's not getting any better. Well, because we haven't mounted the kind of effort it takes to combat a public health crisis. We've worked around the edges, and some good things have happened in this region, and some folks have stepped up, but it's not nearly enough.
So maybe our politician colleagues need to dust off the great work that you organized and take a look at how we begin to fill those gaps and provide the comprehensive care that we need.
Yeah, the gaps still exist. I think there's more awareness than ever before. I mean, if you think about it, you now have candidates for national office talking about the heroin crisis.
Yes.
It's become a big issue in political campaigns. There's more awareness than ever before, but I'm not sure how that translates into action.
I agree.
One of the things you and I have spent a lot of time talking about is how do we get to families and educate them the right way? How do we teach them what signs and symptoms to look for? How do they intervene when they suspect there's a problem? And
That's right.
we still have a long way to go when it comes to some of those issues.
So one of the things that we have changed and has affected at least the prescribing patterns is we do have in New York State now iStop and other mechanisms of tracking the prescriptions and how they're written for controlled substances and whatnot. When we were talking backstage a little bit, still not a great impact and a long time course to really get a change in that area. Is that accurate?
It is, and every time I see a high-profile arrest, it's actually comforting because I think those high-profile arrests send a message to other would-be bad guys that this kind of thing is going to be picked up and you're going to be prosecuted. I think a lot of the bad guys have been weeded out. What I worry about more than that is the 99.9% of prescribers who would never do anything illegal or harmful, but who just need some more education about how to spot the signs and symptoms of doctor shopping, what to do when you think a patient is addicted, who do you refer to, how do you go through the process, suppose they get out of hand in the office.
That's right.
And so we're having more of those conversations, which I think are really important discussions.
So that's a great place for us to kind of end and to say this is an area that we're looking at within CHS and making sure that our providers are aware of this. It was something that I was very receptive to as an emergency room physician. I would see people that would go from ED to ED, and we would have those difficult conversations with them about what needs to change. So I can't thank you enough for coming on this show.
Pleasure is mine.
This is an incredibly important topic. We're not where we need to be. We'll be back with more CHS Presents Health Connect in a moment. Thank you, Jeff. Welcome back to CHS Presents Health Connect. Individuals who are in a situational crisis as a result of alcohol or substance abuse problems can receive protective care at Mary Haven Center of Hope's New Hope Crisis Center in Freeport, New York. Joining us now to discuss the support offered at this location is Mr. James Morse, the Director of Crisis and Residential Services for Mary Haven Center of Hope. Thank you, Jim, for joining us.
Thank you for having me.
It's great to have you. Tell us a little bit about Mary Haven New Hope Crisis Center. What is it? What are the services and what types of clients are you seeing there?
Yeah, New Hope provides crisis residential services. We are a 30-bed inpatient crisis center serving adult males and females with an average length of stay of 7 to 10 days. And what we find now that so many people who are addicted to heroin, we're getting calls from family members who have no idea what to do or where to turn.
Yeah.
They have many questions. Where should I go? Do I go to residential? Do I go to detox? And New Hope is the type of program that really takes the guesswork out of families, because that's in fact what we do. So someone calls up New Hope and they say that a mother has just found out that her son is addicted to heroin, and we say come directly to New Hope. It's a unique program because we're flexible. One of the most important things when it comes to substance abuse is strike
Yes.
while the iron is hot.
Right.
So there's very little red tape. A person can call up and say, I'm in crisis, I don't know what to do. And they come to the front door, they're assessed by a nurse, they're assessed by a counselor, and they're admitted. And then we provide observation and monitoring and stabilization. So we can get a better sense of what the unique needs of the individual are.
Right. It really is a beautiful facility. Tell us a little bit about the types of clients you're seeing. You mentioned in just that introduction there that many times it's a parent calling with an issue about an adolescent or whatnot. What types of clients are you seeing?
Right now, we see most of what we're seeing is the heroin epidemic on Long Island, although we still see other substance abuse and alcohol problems, but it's mostly heroin addiction. And our primary goal, again, is to provide stabilization and to assess what they need, because we know that in 7 days they're going to need further treatment. So we make an assessment of what they're going to need, whether they need a medical detox, whether they need inpatient rehab,
Right.
or whether they need safe and sober residential housing. The staff will provide linkage to those services. We will make the phone contacts. We will facilitate the linkages to these programs and physically transport them. Additionally, we get calls from local emergency rooms.
Yeah.
So someone comes into an emergency room and they were just Narcaned for a heroin overdose and saved. We can come in. We can physically transport ourselves in our vans to the emergency room, pick that person up, bring them back to New Hope.
That is such an important thing for our viewers to comprehend, because when you're describing what you provide, it's crisis stabilization, but also crosswalking and connecting and coordinating the care. So you actually can get someone out of an ED and get them into your center, stabilize that crisis, and then coordinate the next steps of that care.
Assessment, stabilization, linkage, and anything, a client who doesn't have clothes, we might be able to, because
Anything.
they've been on the street. And many of the clients who come in are homeless because they're estranged at this point from their families. So there is no other place for them to go. One of the former clients who came to New Hope, who made a beautiful lighthouse mosaic, said we were the last house on the block. So that kind of speaks to what we are able to do. And folks who complete, let's say someone completes an inpatient rehab and it's 28 days later, they still have no place to go.
Yeah.
They can contact New Hope and we will provide safe, sober, temporary housing until we can get them into a community residential setting, or treatment programs where somebody relapses and they need immediate care, because sometimes when you contact programs to get into rehab, there might be a wait.
Yeah.
There might be a week wait for a bed.
Right.
We can't get in. The beauty of a program like New Hope, it's now. It's now. And then we work with the families, when the families are concerned, that they're just happy to know that their son or their daughter or their brother or their mother or father is in the program, and we can say they're stable, we have a bed date, they're going to be going, and we're going to physically make sure that they get that program.
Well, I think you told an incredible story for really stabilizing a very unstable and expanding public health issue for our region. We're very fortunate to have you with us today, Jim, and very fortunate to have the Maryhaven New Hope Crisis Center as part of our continuum of care. I want to thank you for joining us today on CHS Health Connect. We'll be right back. There's much more work that needs to be done, and we're going to continue to do our part at CHS by providing new services, some of which you saw here today, as well as some new services that will be coming throughout both counties to address the needs of our patients. The last part that I want to address is speaking to you as a parent. I have a child myself, and I don't want to see any more of our children or our loved ones succumb to this epidemic. We need to continue to stay engaged in our children's lives and look for the signs and symptoms of this poison and intervene. And I know we do every day, but you'd be surprised. So many can hide it until it's too late. I want you to know that we're here for you at CHS in whatever capacity you need to help. If today's topic has touched your life in any way, and you'd like to make a gift to support our efforts in combating the current prescription drug abuse and heroin epidemic on Long Island, or if our services could perhaps be of use to you or a loved one, please visit chsli.org. From there, you can click through to each of the campus's websites for more information on ways to give and ways to help. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows or a topic you'd like to see showcased, please do give us a call at 1-855-CHS-4500. Or you can drop us an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.